good. Really good job. They say money can buy you happiness. Money can buy you love. Money can fill this emptiness. I want all the money in the world. Okay. Hello. Good evening. If you're just joining, my name is Nosnello, and today I just want to interact with my fans, with my pregnant mamas, and those that are trying to get pregnant. Okay. Okay. So I'm here. Ask questions. Anything at all that is a problem, whatever it is that is bothering you, ask. I have your time now. I was busy with blood transfusion. We did the exchange blood transfusion. Okay, so basically what I want to teach, as I'm answering your questions, I will also be teaching about it because it's a topic that I would really want to talk about. All right, because it's quite common now, unlike before. So we're talking about neonatal jaundice. It is very common. Okay, most babies come down with neonatal jaundice. And good evening, Anosnello of the Most High. Oh my God. Thank you for liking the live. Thank you. Hey, only me have this plenty name. Okay, so like I was saying, I want to talk about neonatal jaundice. If you have questions, please ask. I will answer your questions. And please, if you're watching me and you have not subscribed to my YouTube channel, it's not good though. People don't want me to grow on YouTube too. And let me grow on YouTube now. And please just subscribe to my YouTube channel. When you see my videos, watch them. Watch them with love. As you're watching them, let your heart be as in, even if it's not related to what you want, you can watch and share to people that really need them. Okay, now let me talk about neonatal jaundice. Neonatal jaundice occurs when bilirubin does not break down properly. Let me use that word. I don't want to use too much medical jargon so that people will understand me. Okay. Now, when a child is in the womb, the mother, the child is taking everything from the mother. So the mother helps the child in doing almost everything. Breaking down of red blood cells and all those passing out of waste, getting nutrients and everything. The mother helps the child. Now, when a child is born, the child has now separated from the mother. There's something we call a red blood cell. I know people know the types of blood. Red blood cell. Now, red blood cell stays 120 days. Then it will die off. New ones will grow. Now, when a child is born and that child has excessive breakdown of red blood cell, like the red blood cell that is broken down is passed out as bilirubin, bile and the rest. Now when this child cannot process it, the child cannot break down the bilirubin, so the bilirubin will start accumulating to now start hiding under the eyes. That's why you see babies that have jaundice, their eyes are usually yellow, then their skin will be yellow. When you touch their skin to be yellow, that's because bilirubin has not been broken down properly. It happens. There are two types of jaundice. We have physiological jaundice and pathological. Physiological means that it starts 24 hours after delivery. 24 to 48 hours after delivery, you notice it. That's why when you give birth to a baby today, by tomorrow or next tomorrow, maybe your mom or your mother-in-law will start seeing the baby. Hey, this baby is yellow. That is physiological jaundice, and it goes away on its own. You understand? Now, most times what we do when a child has jaundice, the best place is to always go to the hospital. We use phototherapy for the ones that are below 12 milligram. There's a measurement, 12 milligram. below 12 milligram, we use phototherapy. We encourage the mother to breastfeed. It will clear off. But once it's above 12, 13, 15, 18, 20, we do exchange blood transfusion. That is exactly the procedure I just completed before coming live. Now, this exchange blood transfusion, what happens is that we are going to bring whole blood from a donor. After screening, we're going to screen. Remember, we'll do grouping and cross matching first. Screen the blood properly from everything possible. We look for genotype. We look for the blood group. Sorry, we look for the blood group. We check for HIV. We check for hepatitis B. We check for VDRL. Any of these infections, we check. They must be negative before you use it on the baby. Now, what we do is we withdraw the blood from the baby, discard it, then take the blood from the bag and replace. Like, we withdraw, we use them depending on the baby, the weight of the baby. If the baby is very small, we can use like 5 ml syringe. If the baby is big, we can use like 10 ml syringe. Now, when we withdraw from the baby, we usually do this through the umbilical vein. That is that umbilical cord. You remember that when the child is born, the umbilical cord is kind of open until it dries off. Now, what we do is we go through that place and we collect. I've been with the doctor since for the past 2 hours now. We have been doing the procedure and the baby is fine. Okay. After that, I did the vital signs and the baby is doing okay. It's a procedure that we do almost all the time because this baby sometimes the jaundice don't want to clear, so we just. And now, do you know that after this blood transfusion, within 24 hours, that high bilirubin will come down because we have removed excess. As we have removed the blood, we have removed excess blood. We have replaced with fresh blood, fresh whole blood. And now the baby is doing well. Now, why I'm teaching you this is many people link jaundice to malaria. Now, it's not really that malaria causes jaundice. It's just that, when you don't treat malaria for a long time, there is this pile up of, if you read malaria very well, you see this kind of the breakdown of red blood cell. This study is a very, very big topic that I will teach some other day. But it is very good for a pregnant woman to just treat malaria. Not that malaria is causing the jaundice. Remember, not that malaria is the one causing the jaundice. Jaundice is caused by when bilirubin, that is the byproduct of the red blood cell, when it's not broken down properly, that is when the jaundice will appear. Now, for a child that their own is just maybe 7 milligram per DL, maybe just little, before 2 days the eyes will clear. That's why some people take their babies to the sun, but it's always better to use phototherapy. And also exclusive breastfeeding helps. It helps a lot. Now, pathological jaundice now is the one that comes when there is an underlying cause. There's something causing it. The baby has another illness, another disease condition, or a congenital abnormality that is making it to happen. You understand? Like, we have a child that has we have a child now that has some sort of kidney problem. And now the baby is manifesting with jaundice, severe one. The baby is more than 3 weeks old, so this is pathological jaundice because it happened after 48 hours. Let's say 24 to 48 hours. Okay, so that is it. That's what I wanted to teach. This was actually done on me when I was born, according to my mom. Oh, are you serious? Okay, I do it. We do it here almost all the time because when we notice that the jaundice, let me tell you what will happen if we don't do that exchange blood transfusion. Now, once that bilirubin begins to pile up and it's more than some babies will even get up to 20. If you don't do something, it causes brain damage. It's called kernicterus. I'm using my accent to pronounce it. Maybe other people can pronounce it somehow. But kernicterus is a very dangerous brain damage. So because we want to prevent it, that's why we did the blood transfusion. We did the exchange blood transfusion. Exchange, we collect, we discard, then we replace. You understand? We collect from the baby, discard, and you know once blood enters that big artery, circulation is very fast. Then after doing it, we now top up. We can do like 40 ml, depending on the size, because the size we use depend on the size of the baby and the amount of the bilirubin. There's some babies that take up to 500 mils of blood, some take less. Like the baby we did today, we transfused the 340 mils. Then we did top up of 40. So that is top up means we are not withdrawing again, we are added. That is the top up. You know, the 340, we withdrew 340 and we added 340. While the top up is we're not going to withdraw, we're just adding to the 340 that we've already added. So that's around 380 on the size of the baby. Okay, so if you have questions, you can ask now. I hope I'm not talking too fast, and I hope you're enjoying the lectures. Okay. All right, so please, if you have not subscribed, please go and subscribe. Subscribe now, so Nosnelo will grow too. Okay, so I just want to spend some time with you guys before I go back inside and continue from where I stopped. I just took a little break, maybe like, let me see if I can stay up there an hour. Maybe by tomorrow I will now relax and we'll do a very good live class. Okay, good evening. Okay, is it the jaundice? Okay, you're asking how I noticed it. Okay, it will manifest now in the eyes. This is called the sclera. If you look at the eyes like this, this whitish part of the eye is called the sclera. So it becomes yellow. As you're seeing, my own eye is white. Once the baby has jaundice, the eyes become yellow. Then the skin tone will become not my skin. The skin of the baby become very yellow. Like when you touch the baby like this, you touch the baby, you'll be feeling, you will see, if you are very observant, if you see a child that has jaundice, you will know, because the child's color will be different from the normal baby color. Normal baby color is usually pinkish, this pink like, to show that the baby is healthy, pink like color. But once the baby start becoming yellow, you'll be looking at the baby, it will be as if it's obvious yellow. That's a sign of jaundice. Then how we now confirm? We now do a bilirubin test, which we call it serum bilirubin test. We will now run it. When we run it, we will now check the amount of the bilirubin that the baby is manifesting. Then depending on the amount, that's when we know whether we are just going to use phototherapy. Okay, I'm not inside. I would have shown you the phototherapy as a therapy machine. We have two types. We have the one we call Firefly. That one is when the bilirubin is so high, we use Firefly. That one is quite intense. Then we also have other phototherapies that we use. So we use the phototherapy maybe 2 or 3 days, the whole jaundice will clear. But if the bilirubin is so high, we cannot use the phototherapy. We'll be using phototherapy. Like the baby now, after the transfusion, we put the baby back on phototherapy immediately. And then by tomorrow, we'll repeat the serum bilirubin test to know how the baby is doing. Okay? All right. This was actually okay. Please, if you have questions, ask. Can jaundice be noticed on the first day of delivery? No, you cannot notice it on the first day. It usually happens between 24 hours to 72 hours. Let me say yes, 24 to 72 hours. That is when you will notice that this baby is jaundiced. You understand? 24 to 72 hours. That is when you will know. Sorry, let me just check. How long can I wait to get pregnant? After one previous year, so that I can try vaginal birth. Okay, you say how long can you wait to after a cesarean section to have vaginal birth? It's called VBAC, that is vaginal birth after cesarean section. It is very, very possible, honestly. But one thing that I believe is telling people the truth. I will not say it to make you feel better. Although I will try my best to say it in a kind way, but I want you to know the truth, because it's only the truth that will set you free. Now, you having a vaginal birth after cesarean section depends on, one, the nature of your pregnancy, two, your overall health, three, progression of labor, and the duration you wait, and the duration after your last cesarean section. If you stayed like 2 years, 3 years after your last cesarean section and you want to try vaginal birth, it is advised that when you get pregnant, you first of all book for antenatal on time. Then after booking for antenatal on time, then you now start working with your doctor. See, even as a nurse, if you see me in my antenatal, I am very thorough. As in, when I go for antenatal, when I'm pregnant, I am very thorough. Because I have access to doctors, I choose my doctor by myself. I will say this person will not see me. Or carry my folder. I want to go and see the head, the consultant on call. I'll go and see the person. Because I love myself so much that I don't want anything to happen to me and my baby. So that is what you should do. You talk to your doctor. Now, the nature of your pregnancy and the reason for the last cesarean section. I missed that one. The reason for the last cesarean section is also a factor. Like if you had cesarean section because your baby was big, maybe probably 4.5 to 4.7 kg baby, there's possibility that the next baby is going to be bigger or as big as the first one. If you had a cesarean section because your blood pressure was high or because you had gestational diabetes, the possibility of reoccurrence is high. So it all depends on the reason for the last years, the nature of your pregnancy, the duration you waited after your last cesarean section, and what was the last one I mentioned? And progression of labor. Sometimes they will allow you to go into labor. If labor does not progress, they will take you to the theater. And remember, a woman that has done cesarean section, they will never induce you. Never. No qualified healthcare provider will induce a woman that has done cesarean section. No, they will allow the labor to come naturally. So if the labor does not progress, they already have plan B, which is the theater. They will take you to the theater and deliver your baby. Please, somebody should go back to the group. Okay, the group is locked. Oh, sorry. If any of the admins are here, or if you can contact any of the admins, please contact them. Tell them to tell people in the group to join this class. Because by the time you start asking me all these plenty questions, I will not answer. Because me, I'm busy. Now that I have time, let them come. Let us talk. So, my dear, did you hear what I said? It all depends. So once you get pregnant, don't lose hope. Talk to your doctor. And please, if at the end of the day, it happens that you're going to do another cesarean section, please don't feel bad. Don't feel bad, okay? Okay, so let me answer the next question. Please just bear with me. Okay, from my routine drugs, I take pregnant care, fertility, vitamin C, paracetamol, not always, and cod leaf oil once 3 days. I'm 23 weeks pregnant. Okay. First of all, paracetamol is not a prenatal vitamin, so please delete it from that list. You only take paracetamol when you are having headache, not even all the time. And it's not every headache that requires any drug. Sometimes what you need is rest. Okay? That's one. I, for one, I don't promote prenatal brands. I don't know if you have observed, you see that I don't promote them. If they want me to do promotion for them, then they will approach me for that. Okay? So, but like I said, whatever you know that is healthy, do it. Whatever you know that will be good for you and your baby, please do it. Anything you know that is detrimental to you and your baby, please avoid it. Personally, you see folic acid, fertility, B complex, the rest of it, nothing is wrong with it. But if you want to take those ones because you're comfortable with them and your doctor have assured you that it is okay, fine, you can take them. Okay. Okay, thank you for the lecture, ma'am. I'm 17 weeks pregnant, and I notice anytime I sit for long, my my lower back, like towards the tailbone, begins to pain me. And it's weight now. It's weight of a baby. Sorry, this my light is disturbing my eyes, so I can't really read clearly. So I have to move forward. Is weight of your baby. Sometimes when you sit on a chair, just use like pillow. Just place it at your back and sit. Pregnancy is a roller coaster ride. A lot of things will happen to you. Your eyes, you just stay like this, your eye will be doing like this, your eye will be blinking. Before you know, you start hearing noise inside your ear. Pregnancy is funny. It's a very funny something. Okay, please, can you speak on gestational diabetes? That's a very big topic, baby. Okay, let's say I will talk about it, but not today. I will. Either I will do it as a video, or I will drop it. I will do it as a live class. Okay. So just, it's a very big topic. Okay, I will do it for you. All right. This is a Luchi Gloria. Thank you. Okay. Good evening, nurse. Please, when do you think is the right time to take off from work, like leave, especially if you work very far from home? 8 months. Yeah. Not the beginning of 8 months. At the end of the 8th month, please just go and rest. The 9th month of your pregnancy, just stay at home. Depending, okay, like you said, the place is far. Imagine the stress of going to work every day. So if I would advise, once the 8 months end and you're entering first week of 9 months, please just stop. You need to stay at home and rest for like a week or 2 before your delivery. It will really help you. It will help you to prepare. It will help you to pack your things. It will help you to organize your house. It will help you to rest. If you can do it, it will be very good. Don't work until the day you will deliver. You will be so disorganized. You'll be crying every day because everything will just be jam-packed. The stress will be too much. But if you have the opportunity to choose when to go for your leave, my dear, choose just 1 week into 9 months. Take your leave. Stay at home for like 2 to 3 weeks before your delivery. Hi, you will come back and thank me later. Please, it will really help you. Okay. All right. Hello, Chika Okafor. Nice to meet you. Akwabio Rejoice. Nice to see you too. Good evening, Chinaza. Okay. Good evening, ma. Please, when is the best time to start antenatal once you confirm you're pregnant? Like I always say, first of all, before you talk about antenatal, once you find out that you're pregnant, please go to the pharmacy. Prenatal vitamins is an over-the-counter drug. Does not need prescription. All right. So go to the pharmacy first. Buy your prenatal vitamins. Then, if everything is okay with you, everything, when I say everything, I mean everything is okay with you, 3 months, that is the end of your 12 weeks. By that time, you now go for your first scan, you do everything, run your routine test and everything. But please, if at any point in that pregnancy you start feeling unusual, the abdominal cramps that is normal start becoming abnormal, the headache that is normal start becoming abnormal, or you start bleeding, or you start feeling something that you don't understand, please go to the hospital. And if you have experienced any form of miscarriage or spotting before, once you get pregnant again, hospital. Don't wait for 3 months. 3 months is only for people that are feeling okay, like you've checked yourself, nothing is wrong with you, you are okay. You can wait till 3 months. But please, if there's any other thing apart from what I just said now, register on time. Okay. All right, let's go to the next question. You jumped my question. Oh my god, how? Please, can you ask it again? Okay. Ma, I'm having watery stool in the 3rd trimester. Does it mean that? Okay, what does it mean? Watery stool can be a sign of labor. Depending on the type of the length of the 3rd trimester, maybe you are at the end of your pregnancy. could be a sign of labor, it could be a sign that your body is getting ready. Okay, and also it could be a sign that you have eaten something that has upset your stomach. So if you know you ate something that probably upsetted your stomach, please just stop it. Okay, all right, please ma, you told me to use oil concerning my eating, but you did not indicate. Sorry that I'm laughing. What's your name? Okay, Rejoice. I meant baby oil. Baby oil, like can use coconut oil, can use all this sweet smelling baby oil. You drop it inside your water, then you bathe with it. You don't clean your body, allow your body to dry. Don't scrub your body with sponge, just use mild soap. Mild baby soap is okay. Then after that, you just apply the oil on your body. Not palm oil, it's baby oil. Okay, all right. Thank you. See my lovely Nostello. Does constant slight headache, dizziness, fatigue, mood swings signify want to be pregnant even before missed period? Yes, those are the signs. Just be feeling as if something else is wrong with you. You'll be like something is happening to my body that I don't understand. What is that? It could be pregnancy. It could also mean a lot of things. But the only way for you to find out that it's pregnancy is to run a pregnancy test. Okay? You do a pregnancy test to find out if it is really pregnancy. Okay? All right. Please, ma, can I start exercise? I'm already in my second trimester. Staying active in pregnancy is very advisable for everybody. You can do little workouts to keep yourself fit, not the kind of workout that you're using to induce labor. Don't go and do that one. Those jumping around, walking, squatting, doing this one. No. But staying active is okay. It's a pregnant woman. All right. Okay. I'm 34 weeks, but have a lot of tiredness after house chores. Is it normal? My dear, don't you have help? Get help now. You already carry, even the baby you are carrying is a wahala on his own. Imagine you not carrying another thing, as in adding another stress to the stress. Sorry, my light has fallen. To the stress you already have. You self check am now. You're already stressed, and you're carrying another stress and adding on top of it. The baby alone is stress for you. So if you're tired, please postpone the house chore and do it later. Or you look for help. Okay? Alright. So please, may I have plenty questions. I have subscribed though. But what people are doing to me is not good though. I've been begging people to subscribe to my YouTube channel. People are not subscribing. Over 1,000 plus. I have 2 groups. So the second group is about 300 and something. The first group is 1,000 plus. I'm supposed to be having like 1,500 subscribers by now. What people are doing to me is it fair? People should check them now. It's not fair. Okay. Let me see. Nurse Nello, please, what type of supplement can I take to improve my pregnancy health and also my baby? My friend said that not taking extra supplement may make the baby tiny. They have started. These are the things that used to make me and them to fight. Who is that friend? Where is the person from? Mind your friend, Jared. Yeah, take your folic acid, fesolate. You can also include like that cod leaf oil that the other lady said she takes is okay. Sorry, my darling, for not mentioning your cod leaf oil. It's very nice. Okay, you can take cod leaf oil. You can take vitamin C, fesolate, folic acid. I keep mentioning it first. Fesolate, multivite, B complex. A lot of people don't like B complex, but it's actually very nice. Okay. So you can take all those ones and you understand. Just this my light is disturbing, so I'm trying to make it steady so I can continue with the questions. Okay. The next one says, uh I hope you understood what I said. So please, not taking any extra will not make your baby tiny. Alright? Nothing like that. Baby is fine. Okay, I have another question. No problem. That is not why I'm here. I had CS in my previous pregnancy because my baby was presenting with the bum bum. Is it possible for me to try natural birth in my next pregnancy? I've explained this. Probably you asked before, but I've explained. Depending on nature of the pregnancy, how long you waited, if they allowed you to go into labor, if the labor is progressing or not, and the reason for the previous years. Like he said, it was breech. If it is breech again, they will not allow you to push. So all these factors will really tell if you deliver through cesarean section or not. Okay, please, is it normal to see only gestational sac at 6 weeks? Yes, it's early. It's quite early. All right, it's quite very early for you to see only gestational sac at 6 weeks. Quite early, but just wait. Probably in the scan result, they'll tell you to come back after 2 or 3 weeks. I know they'll tell you to come back. So when they tell you to come back, you go back and check. Let's just hope and pray that the baby will be visible by then. All right. Okay. Patience has finished. Okay. Okay, please, ma, when is the best time to take calcium? Very good question. 20 weeks. Thank you. 20 weeks. And I'm going to explain. Calcium in your body in early pregnancy is enough for you and your baby. Taking it too early can cause hypercalcemia unless it has been prescribed by your doctor specifically, probably because they checked your calcium level and it's low. But if it is normal, by 20 weeks, your blood calcium will start depleting because the baby is taking more of it to build the bones, all the limbs are forming. So the baby is taking it from you. So the mother's calcium will reduce, and to help the baby and also help yourself, you take calcium tablets for 20 weeks. Sometimes if you don't take your calcium supplements, you see those joint pains and leg pain to be very, very hard on you. But if you watch yourself, you observe that if you take your calcium consistently over time, you start feeling relief in all those leg pain, waist pain, all those joint pain. So that's 20 weeks. Okay, ma, I just finished taking my routine drugs. I'm feeling pains now. What kind of pains are you feeling? Somebody said I skipped her question, so I'm going back. What kind of good? Look, please, can you speak on this? Okay. Okay. So somebody said I skipped a question. Okay. I am Nigerian girl. I like Nigerian girl. If you're yet to like the life, please like I said before. Okay, I have more questions now. Okay, she said, please, ma, my husband is not in Nigeria and people have been saying you need a man. Okay, I don't want to get scared though. Please, what can I do to help you? People. Most of the problem we face in this life are people. This people syndrome. They are most of the problems we face in this life. People syndrome. What people will say. Why people are saying what they are saying. People said this. People said that. Don't mind them. Nothing will happen to you. Nothing will happen to you. The reason why we encourage intercourse during pregnancy is just for you to be okay. It doesn't add anything or remove anything from labor, medically speaking. All right, as far as your husband is not around, my dear, carry your pregnancy in peace. Don't allow anybody to pressure you into doing something that you will regret. You hear me? That's all I can say. All right, what is the highest number of times a woman can pass through CS? Good question. WHO said 6. Yes, 6. 5 to 6. All things being equal, 5 to 6 times. All things being equal, like they have checked you from head to toe. Nothing is wrong with you. You're not having blood pressure. You're not having diabetes. You're not having any of these things. If you're okay. But I see no reason why a woman would even want to go to do CX 6 times. What's up? Why would you do cesarean section 6 times? For what? What would you use it for? I think to me, maximum should be 4. To me, maximum should be 4. Like if you maybe want like 4 children, 4. After 4, just stop. Because it's high risk on its own. So let's not add it. All right. If you have questions, I'm waiting for questions. If I'm not asking questions, I think this is the last question there. All right. Please, I have 16 people watching me. I'm happy that you responded. All right. Tomorrow I'm going to go live again. So we're going to discuss in the group the time you want the live. If you want it during the day or you want it at the night, to talk about it in the group in the morning. But for now, I have to go back inside. Now I'm working. Okay, I have to go back inside. All right. I just wanted to make sure that I give you people at least this is 37 minutes. I give you at least 40 minutes of the time. All right. So please, if you finish watching this live, please share it. 16 of you, if 16 of you share this live, many people will see it and they will learn 1 or 2 things from it. Share the live. Okay. I know I still have a lot of questions. Okay. I've asked you 1 question for more than 5 times. Oh. Hey, pregnant women. So I look like somebody that will see your question and will skip it. Like I just came to YouTube live just to skip only your own question. As you are typing what you are typing. Now the time you used to type this thing, now I didn't you use it to repeat the question. At least I would have seen it now. People just want to. People just like you want to trigger me. I don't know. And I will just come to YouTube live and I will just ignore your question. Only you. Like what did you do to me? Did I see in my dream that I will see your question and I will just abandon your question and be answering other people's own? Pregnant women, oh. Ma, please, you don't like coming to Facebook. Why? I come to Facebook, I'm angry. Please don't be angry, oh. Please don't be angry. Chizoba. Bikono. Should I speak Igbo for you? Don't be angry and ask me again. Just bring the question. I will answer you. I promise. I've already known your name, so I will answer you. Hey, pregnant women. People should leave us alone. Hey. Okay. Ma, what's the natural way to conceive a baby boy? This expensive question that you're asking. No wonder you're angry. Expensive. If I tell you this thing now, you don't know you're going to pay me. Okay. The best way to conceive a baby boy is when God gives you a baby boy. That's number 1. It's God that gives children. I hope you know. Then medically, you can track your ovulation. How do I mean? instead of meeting with your husband days before your ovulation, meet with your husband on the day of your ovulation and a day after your ovulation. You get a baby boy. It's as simple as that. That is if you understand your cycle. That's why I made the video on menstrual cycle. Okay, but probably I'm going to make a video on how to conceive a baby boy. You understand? So that I can explain it in details. But you know, we have fertile window, like I said in that video. If you have not seen that video, you are missing 5 days before and 2 days after. So 5 days before, if you sleep with your husband, 2 days after, you might get pregnant. But if you wait and meet with him on the day of the ovulation, on the peak day, that day that you know that the ovulation is going to come out, or a night before that day, on that day, and a day after that day, your chances of conceiving a baby boy is very, very high. All right. Ma, I have not missed my period yet, but I'm feeling some pregnancy symptoms. Okay, let's wait now until your period date passes. Once it passes and you don't see, I pray you don't see it, and you don't see it, just go and run a test. Okay, I pray that you get a positive result. All right. Yes, it's possible that you're pregnant. It's possible. I greet you majestically, Wanyam. This greeting, this greeting is making me glow. This greeting, making me feel myself, Joe. Thank you so much. I greet you too. I greet you people too. I want to go. I'm working. Please just bear with me, okay? Just bear with me. But before you know it, I'll be by tomorrow. But I'm trying to see if I can squeeze in 1 hour, but I have babies to take care of inside. I just came out and said, hey, I promised people that we're going to do live today. Let's do it. Please, share it, please. I'm begging. And if you have not liked the live, please like it. Like it now. Like the live. If you have not liked it. If you have not subscribed to my YouTube channel, what you are doing to me is not good. Post it on your WhatsApp status. Do you know what you will tell them? Follow this midwife. Just tell them this midwife will no road. Follow her. If you are pregnant or you're trying to get pregnant, follow this midwife. Post it on your YouTube, on your status. Subscribe, please. All right. Any other question? Think okay. I have more question. You think? Okay. Ma, I have not missed my period. Okay. Amen. You just made me smile. God bless you, ma. I'm happy that you're smiling. You don't like coming live on Facebook. Okay, that's what I mean. Okay. I think I came live last month on Facebook. This YouTube live, I just started it. I just started it newly. I've been going live on TikTok. See, people don't understand. I have 3 children. Those people that have 1, how are you feeling? Imagine me that I have 3. So stressful. I don't know where I get the energy to do all these things from, but maybe because I love doing it. So it looks like that's become a lifestyle for me. It's no longer about the money. To me now, it's no longer about the money now. But I also want the money. I want the money now. But I just love what I do. And I have other things that I'm doing too. I come to work, I do my personal things, my family is there, I make videos. So the stress is too much. So that I will just tell one platform, the rest, let me do this one. My Facebook and TikTok have grown. YouTube is still growing, it's still crawling. So I'm trying to build my YouTube channel. That's why I need your support. I need all your help. See, this is the only thing. Because I'm not charging you people anything now. So if YouTube starts paying me now, That will be the reward for my hard work, right? I deserve it. Mm? You just do it for me. I know it's going to take time for them to think about monetizing it, but at least they say a few drops of water makes an ocean, abi? Just keep dropping it before you put a bucket in a tap that is dropping. Before you go home and come back the next morning, that bucket will be full. You'll be asking yourself, how come just little drops makes an ocean? Okay? So if you follow me and you see my video and you lovingly share it, like you watch. I know sometimes I have longer videos, at least watch it. That's the support. You watch it, even up to half or something. If it's exactly what you want to hear, watch it. After watching, share the video to your friends. Put it on your status, share it into the groups that you belong, especially groups where you have other mothers with you. When they watch all those things, they learn. It also give a publicity to my page, to my channel. Okay, let me go back to the questions. All right. Miss, can you sleep on both sides in early pregnancy? Yes. Even let me give you a in early pregnancy, you can even sleep with your tummy. Because that time you'll be having that abdominal cramps. Sometimes when you sleep on your tummy, when you place pillow on the bed and lie on the pillow with your tummy, it's so soothing to just relieve the stress. But once your pregnancy starts growing, please stop it. Ma, is it possible to space your kids every year, even with CS? 2 years is better. At least if this one stays up to a year and 3 months, then you take him. Before you will deliver, that one should be like 2 years plus. It's better now than doing it 1 year. It's not your body. You know that this thing is knife. They're using it to open you up. And the more frequent you do them, the more you're giving your uterus, you're making it at risk of tear. Like what I mean, you don't allow the previous stitch, as in the previous stitching to heal properly, then you not get pregnant again. You now, as in they will come again and cut on the same spot to not heal properly, taking again. Are you not a human being? Pity for yourself now. So space them. 2 years is okay. At least you two, you will rest. When you finish giving birth to the number of children you want, like 3 or 4, you not take care of yourself. Yes, it's very stressful. Okay. Hope no complications will arise. Okay, I've answered you. Thank you. All right, we're almost getting to 1 hour. Okay. So my husband bought nkwobi for me. And you people are not making me to enjoy it. And I'm eating it with my hand. You people are not making me to enjoy my nkwobi. So it's time for you to go so I can enjoy my nkwobi alone. Okay. Thank you so much for staying by. But if you have questions, ask. I just want it to get to like 1 hour. Let me stream it for 1 hour. All right. By tomorrow, you stay as many hours as you want. Tomorrow, if you want us to stay 4 hours, we'll stay 4 hours. But let me just close for work. Night shifts can be very stressful. Okay. What is nkwobi? Okay. Do you know this locust bean? I don't know if you know locust bean. In our place we call it oba. Other tribes in Nigeria, I don't know what they call it, but it's locust bean. So we now mix it with cow tail or cow leg. We use oil. Not really, we use oil. And there's something we call ngo. It's called water that we sieve from God, how would I explain this? Okay, let's say we use oil, with locust bean and cow tail or cow leg. Now mix it together. It's so delicious. It's our tradition, our native food. We call it African salad. You understand? So that's what I'm having. For your encouragement and teachings, you're welcome. Thank you so much. I'm so happy that I'm speaking with people. Just that we are at 50 minutes. I just want it to get to an hour, so it will be recorded that I streamed for 1 hour. Okay, please don't forget to share. Share the live. So maybe in subsequent times, what I will do is when I go live, I will invite people over. You come and you say what, as in you explain your question, you say it, other people will hear it. But today I'm actually in a hurry because I'm at work. All right, I just ran out to come and do this. I'm going back inside. Okay, thank you for all the teachings. God bless you too. Bless you so much. Me, once they give birth, sometimes pregnant women, once you give birth, people forget me. You see, somebody chatted me on TikTok, commented on one of my videos on TikTok. She was like, I just gave birth to my baby. I followed your page from day one till I gave birth. I said, that means I have been on this space for a long time. For her to be pregnant from day one and she followed all my teachings until she gave birth. I was so happy. Like, I can't believe that I'm almost a year in this journey. And I'm happy doing it. All right. There are people that follow me quietly. They follow me quietly. You don't even know that they are following. They follow all the teachings. I'm happy. One is for you to stay healthy. All right. Okay. All right. So where is this, my friend Chizoba? I think it's Chizoba Favor, right? The lady that said I did not answer her question, has she gone? Okay. All right, my darlings, I will see you guys some other time. Okay, maybe tomorrow. Okay, if you're in my group, we'll talk about it in the group. I will ask the best time, if you want it in the afternoon time, when I'm, or the morning time when I'm free, then we'll have a live session. All right, it's very convenient by that time. Please share. Please, before you leave, make sure you share this live. Please share it, that people can watch it. People can see. They will learn. The first part of it was more of teaching, so that they will learn. Okay, just share it. Okay. All right. Thank you very much. I will see you guys in the group, and bye. Okay. Wait, let me see if I can share the live. Oh wow, can you share it on? Okay, I can share it on Facebook. Okay, maybe tomorrow I'll look for a topic. So somebody said something about gestational diabetes. Okay, so I'm going to start with it tomorrow. All right. Bye. Am I going to end it? I'm still here asking the same question. Which question? You asked me how you're going to get a baby boy, and I've answered that question. So you left here and allowed me to answer it, then you come back. It's like you like fight. The way I'm seeing you want to fight again, and you not choose any other person. It's me that you chose to fight with. I don't have anything to say to you. That is the only thing I'll tell you. I have nothing to say to you. If you are in the group, wait for me in the group. Remind me that you are the one. Let's finish the fight there. Okay?